My name is Alexandra Taggart, and this is my video presentation on the psychopharmacological treatment for a client. So my client's name is Tom. He's a 45-year-old male who's suffering from generalized anxiety disorder, or GAD. According to our textbook, generalized anxiety disorder is an undue and persistent worry about two or more life circumstances that occur for at least 6 months. The main feature of GAD is uncontrollable, excessive worry that crosses multiple areas of life, such as work, health, and relationships. Other symptoms of anxiety, such as inattention and muscle tension, might be present. However, the excessive chronic worry becomes a barrier to happiness for the individual. Tom's GAD is causing problems at home with his wife because he's always stressed out, and this stress is causing tension on Tom and his wife's relationship because he often takes his stress out on her by blaming her for things and getting into arguments with her. Tom's also having problems maintaining a focus at work because of his GAD. So this is Tom's psychopharmacological treatment plan, and it includes 3 long-term goals. So the first goal for Tom is to gain the ability to understand, recognize, and cope with his anxiety symptoms. This goal is going to help Tom to have a better relationship with his wife because he's going to be able to recognize his anxiety symptoms and not blame them on her. He's also going to be able to focus more at work because he's going to be able to cope with his anxiety symptoms better than he previously has been able to. Tom's second long-term goal is to develop cognitive beliefs and behavioral patterns that will help him to control and reduce his intensity of his anxiety symptoms. So this goal is going to help Tom to gain control over his anxiety symptoms by taking control over his thoughts through rationalization. The third long-term goal for Tom is to increase the ability of self-regulation in order to complete his activities of daily living. Teaching Tom self-regulation skills is going to ease his anxiety and allow him to continue his activities of daily living. These are Tom's 3 short-term goals. So the first short-term goal is to take medications as prescribed by his physician. The plan to meet this goal includes first scheduling an appointment with a doctor for medication management. Then the medication education must be provided, which includes the effectiveness and the adverse effects of the medication. Tom's going to be encouraged to report any other medications and over-the-counter medications that he's taking to reduce the risk of any interactions. The role of the social worker here is to assess for medication compliance, look for side effects, and for contraindications of the medication. The second short-term goal for Tom is to reduce any at-risk and harm factors. So in order to achieve this goal, Tom will be assessed for suicidal ideation, homicidal ideation, and morbid ideation. If any indicators are given that Tom may be in danger of self-harm or harming others, then hospitalization must occur. The social worker is also going to assess for external factors that might be influencing an altered mental status, such as substance abuse. The third short-term goal is to develop positive problem-solving strategies to accomplish tasks. The social worker should help Tom in developing plans that he can implement in response to expected and unexpected stressful events. Tom should also be helped to identify an exercise routine or an activity to participate in regularly each week. Now, this is going to provide Tom with an outlet to his stressors and anxiety by helping him to relax his body and to focus his energy into something positive rather than stressing out and having anxiety over everything. Next, I'm going to talk about the medication class, the functioning, and the side effects, or what to expect. So the medication prescribed by Tom's doctor is Buspar, or buspirone. This is a popular medication that's used to treat anxiety, and it's not related to benzodiazepines, barbiturates, or other sedatives. So Buspar is a psychotropic drug, and it is of the aspirone chemical class and a spiral compound. This medication helps to control the symptoms of irritability and pounding heart that's commonly associated with anxiety or generalized anxiety disorder. Buspar does not cause sedation, and it can be used long term better than the benzodiazepines can. So the side effects associated with Buspar can include dizziness, nausea, headache, nervousness, lightheadedness, and excitement. The patient's also going to see minor improvements in anxiety, and this can occur 7 to 10 days, but the full effect might not be felt for 3 to 4 weeks. So because the effect is so delayed, it's important to note that medication alone is not going to help Tom. Tom's also going to have to attend cognitive or behavioral interventions in addition to his medication to help him cope with his generalized anxiety disorder. These interventions are going to help Tom to identify anxiety stressors, identify self-coping mechanisms, and help him find ways of alleviating stress. These skills are going to help him meet his goals and his intervention plan as well. So the last thing I'm going to talk about is the social worker's role in supporting Tom through his medication trial. The first role a social worker will take in supporting Tom through his medication trial is to first educate Tom on his medications, the dosages, and the side effects. The side effects is going to be something really important for the social worker to educate Tom on, especially the dizziness, as this can lead to falls, and that's going to be really dangerous for Tom. And she also needs to alert the wife as well to watch for him, especially during position changes. The social worker should also encourage Tom to identify and verbalize anxiety-producing cognitions in order to help him to better self-regulate. Sometimes just talking about our feelings is a good way to help us understand how we're feeling, and the social worker should also encourage Tom's wife to listen to Tom about how he's feeling so that she can better relate to him and understand more of what he's going through. The social worker may also conduct reality test cognitions that help Tom to differentiate between functional or dysfunctional beliefs of anxiety. After this is done, Tom can be encouraged to identify and replace non-functional beliefs with the functional and positive beliefs. The social worker can also help Tom to identify self-relaxation techniques to alleviate any anxious symptoms. Together, the social worker, Tom, and his wife may even be able to find group self-relaxation techniques such as meditation, and this is going to encourage a healthier relationship between Tom and his wife. It's going to allow them both to relax, and once they're in a more relaxed state, maybe they could talk about their feelings, and Tom will be able to express his anxiety more to his wife, and that will help him to understand what he's going through and help her to understand what he's going through better. So that is my intervention plan for Tom and his generalized anxiety disorder. I thank you very much for watching my video.